happy to have you here for the advocacy webinar on this kind of chilly November morning, kind of rainy down here in Columbus, Ohio as well. I want to make sure that everybody can hear us. Derek is not doing the webinar for the first time since I've been here, so we're kind of trying some folks out. So if you can hear me, can you just someone kind of type in yes or whatever you want to type in? That would be great. Just to let you know that we are moving. Beautiful, beautiful, beautiful. Thank you so much. Lots of yeses. Wanted to go forward with, first of all, what's going on down at the State House. The first bill that I'm going to talk about is House Bill 250, which is House Bill 248, which is a crush-proof medication bill. It's a lot easier to explain than to actually say, I guess, the title. Basically what it is there's a reformulation of existing opioids, which makes it much more difficult for an abuser to crush the pill, snort it, melt it over a flame, and inject it into the system. These are actual talking points from Representative Sprague, who is the sponsor on the bill, and Representative Antonio. You have a Republican and a Democrat. It is a bipartisan bill. Basically what it does is if there is it's kind of left up to doctor determination whether there is some kind of issue that a person, there's suspicion that a person may have some kind of problem with opiates, and this would actually be something that they would then prescribe. Doctors would be given the ability to prescribe these medications, and insurance companies would have to they'd have to cover this under the insurance plan if there's some. It would not be for everybody. I know that there have been some issues. I've been asked the question, well, if there is someone who is old and and has needs it for whatever, they need to cut it in half or something like that, would that still be able to be done? Yes, this just gives the doctor the ability to prescribe these crush-resistant medications for those who are suspected of perhaps having some kind of opiate problem. When we had a press conference not too long ago on this issue, and it was quite amazing. Like, they took a hammer, like a bulking hammer, and just hammered the living holy stuff out of it, and the thing did not even a little chip pieced off. It was pretty amazing what they're able to do with this. And so this is something that we have been kind of quietly pushing. This is something that I know that the sponsor, excuse me, the sponsors are looking for advocates to push this along, Sprague and Antonio. So we have been, if you would like to be part of the for this, let us know, because we are needing more sponsors on this bill. The insurance companies are kind of fighting this pretty hard for the simple fact that it does cost more money for insurance companies to cover these types of medications. So this is something that folks probably would benefit from. Again, one of the other things that we try to push in some of these bills are the ability to the ability to also refer people to treatment. That's what we've been encouraging these folks as well. We need some more treatment opportunities. Perhaps an assessment could be done at an emergency room or a doctor's office. We need to encourage that as well. So, but this is something that talking points that they have used in the importance of passing this bill. So this should be going on in the next couple of weeks, hearings on this bill, hopefully before Thanksgiving. Some other things going on at the State House. House Bill 250 is a prior authorization bill. Basically, it's another kind of keep the pills off the streets type of bill where if a person goes into an emergency room, if a person goes into a doctor's office, again, the doctor suspects that there is some kind of opiate abuse problem, then what happens is the person would have to get a prior authorization. Prior authorization, and this is for Medicaid, people on Medicaid. Prior authorization is basically the state has to approve the medication. They could take up to 2 days before that prescription is authorized, and it's filled. It's able to be filled at a pharmacy. Again, this is up to the doctor. Whether the doctor's seeing anything. We gave testimony. It was kind of a soft proponent testimony on this bill. Again, we're really pushing that we can't just do things by trying to take pills off the streets. We need to put more money into treatment. We need to put more money in prevention and recovery. That the continuum of care is actually what's going to help folks get off of any kind of abuse that they may have of any kind of medication or of any kind of illicit drug. That doesn't that just taking the supply away is not nearly enough. And we've seen this throughout all of the last 30 years. First there was crack in the 80s. We took that off the streets, made it a pretty we put a lot of law enforcement behind that. Then it became meth in the 90s, and then prescription pills, and now it's heroin. So even though you may be taking the drug of choice away, we are pushing that this is not about the drug. This is about trying to get a person help and treatment. So we're trying to push that in that bill as well. I don't know if this bill is going to go anywhere, quite frankly, but it is something that that's out there. Some other bills that we're looking at, House Bill 68 seems to be getting some legs. It's a beer content bill. Basically, it would raise the alcohol content limit from 12% to 21%. They claim it's more for the craft beers. Anheuser-Busch is not going to all of a sudden, because one state decides to up its limit, they're not going to create a whole kind of line just for Ohio. But we are opposed to this bill, obviously from the point that there be more alcohol in the same amount of beer. And young people get a hold of this, it just causes more problems. Also, the education that would have to be done to the consumer, that maybe you can have 2 beers and you're okay, but with this you're almost doubling the amount of alcohol content in this. I mean, you could get pretty schnockered on just a couple of beers, and this is a big concern of ours. How much community education would actually be done for folks who actually drink alcohol? There's also House Bill 270, again, which has some legs, which would basically strengthen the drug dealers, and it would be they'd expand the definition of involuntary manslaughter to include drug dealers in this. So if a person does provide a drug to another person, and a person does die, that they could be charged with an involuntary manslaughter, which is a bigger penalty than what they have right now. There's also 2 Good Samaritan bills that are on the agenda. I know that the heroin Good Samaritan bill, House Bill 249, they would like to pass by the end of the calendar year, so by the end of December. It's still in the House, so it's going to be an uphill climb, but they do want to take care of that. Basically, what either of those bills would do is if a person is with another individual who is using, and for heroin, for example of heroin, if 2 people are using heroin together, the person who overdoses is lying there going into an overdose state. The other person who might be using heroin sees this person, does not want to get into trouble, so sometimes they leave that person just to basically die there. So what this would do is grant immunity to a person who is with another person going through an overdose process, overdose, and gives them immunity from being convicted of any kind of heroin possession crimes or anything like that. Alcohol would be more about the underage drinker, House Bill 201. That doesn't have as big a legs as, especially with Stinziano, the Representative Stinziano leaving the House. He's going to be part of Columbus City Council now, and he's the sponsor of this bill. The alcohol piece is about a person who is underage and might see someone having an alcohol problem. They might be drinking together underage. This would grant immunity from someone who is who would call 911, get their friend some kind of emergency help. This would give them immunity from getting an underage drinking charge on their record. So we think these are both obviously not prevention bills, but as far as saving lives, we think that these would give some folks the opportunity to make those calls and to save people's lives, so that we do have interest in both of those bills, and actually think they would be good as far as kind of preventing death more than preventing abuse. I know that in the heroin bill, there's been some talk about adding treatment for anyone that does call in, adding a treatment component to that to try to get that person off of heroin as well. But we don't know what the amendments look like right now. So those are some of the bills that we're looking at the State House. It seem to have some kind of following that we'll look at and may pass in the next couple of months. The next thing is we'll be looking at, obviously, is the House Bill 230 that also that kind of changes some of the definitions of prevention, changes it from alcohol and drug prevention to prevention services to reflect the behavioral health focus that the federal government and state department are looking at. So this is another bill that we're going to follow, although I don't see any passage of this by the end of the calendar year. Let's go on to the marijuana. We won last week. All of the hard work, all of the great things that you did throughout this entire year, we won. We won pretty handily. That was one of the photos from Kurt Steiner, who was the chairperson of the No to Ohio marijuana monopolies, whatever they call it. But he ran the campaign and did a lot of hard work as well. This is how basically the statewide election results were. Issue 1, which was a redistricting amendment, was added to the state constitution. Basically, it changes how folks can look at redistricting. So it's been kind of an unfair process where the people, the party in charge gets more of the power, so then they swing it to obviously their power, their own party, to how they redistrict and can get more seats. This kind of changes that, and both Republicans and Democrats were in favor of this, so it passed by a pretty wide margin. Issue 2 is the anti-monopoly amendment, which basically now there has to be, before there's any kind of amendment put on the ballot, it has to go through a ballot board process after they get the signatures, and then this ballot board, this group of 5 people, would have to determine whether this is a monopoly or not. So it's just another step to protect Ohio's Constitution. It was interesting, the different, the different thoughts on this amendment as it was getting closer to Election Day. There was everything from, oh my God, it's going to take away Ohioans' rights to vote, to this is the medical marijuana amendment. So there were all kinds of weird variations about how this was going to be looked at, but it really is just an anti-monopoly bill. Issue 3, legalization. Not only did it get defeated, it got defeated handily. I know going into the election, some of the polls were showing that it was neck and neck. It was going to be a very tight race. The people of Ohio overwhelmingly voted against legalizing marijuana. So we're extremely happy about that. And why did this happen? It happened, well, we're going to look at the state first off. And it failed, marijuana legalization failed in every county in the state. They didn't win one county. So it was really overwhelmingly in favor of our side. And just something, you have Hamilton County down there at 42%. That was about the closest. Steubenville over in Jefferson County also had 42%. Basically, the reason that the Southwest Ohio was so highly representative of more than the rest of the state was basically the investors were down there. They were community members down there. So it wasn't anything that I know that the people in Southwest Ohio worked extremely hard on this, and they, quite frankly, had an uphill battle because so many of the investors, so many of the community leaders of Cincinnati actually had money put into this thing. So they just had a tremendously hard fight, but they still had an overwhelming victory even in those counties where the people were from. So very good news. Some of the reasons the election was such a crushing defeat, I like to say that, a crushing defeat for legalization, was, quite frankly, education began early on. We've been doing this for 3, 4. I know that the position paper was put out long before. We at Drug Free Action Alliance had a lot of these different seminars and forums, and I know that ADAPO has done some great things as well. But education of all of these, of the perils of marijuana legalization have been, it started early on. So we really are excited about that. This is your work. When we look at this year, when we look at 2015, we have had 2 huge wins that we really need to be proud of, that really, quite frankly, and as we sat, Marcy and I were invited to the No on 3 party, and the Senate President, Keith Faber, and the House Speaker, Cliff Rosenberger, looked and said, you know what this was? This was a grassroots movement, and that's why we won. We got outspent 15-1 on this issue. It was $40 million to like $2 million or something like that, or maybe $3 million. We got outspent tremendously. We couldn't match them on commercials. We couldn't match them in their little flashy things they sent to us in the mail. They couldn't. We couldn't match them on any kind of money. However, we had the grassroots effort going, and it's because of the work that you've done. So really take a bow this year, because you have really defeated something that a lot of people said couldn't be done. We were at David and Goliath. We weren't going to win. I heard all of these things from across the nation. There's no way that you can stop this. And the next morning, the amount of emails and texts that I got from people across the country saying thank you, saying, you know what, you just took away the whole inevitability argument they use so much. They can't say that anymore. We had over 125 organizations on the No on 3 campaign. Some that were traditional folks, the children's hospital groups, the law enforcement, but we had non-traditional. At the last minute, the Stonewall Democrats from Ohio State University joined us, saying this is not a good plan. We had the NAACP join in and say this is not a good plan. We had so it was not only, we had the Libertarian and the Green Party, which can't agree on anything, actually come together and say this is not a good plan for Ohio. There were some people that they based this on the issue, not on legalization, but we all came together, and quite frankly, a lot of it is from the things that you're doing in your community. So really, just be proud of the work that you do. Some other things, absolutely, Responsible Ohio. There were some articles that said, well, this is not so much a win for the anti-pot people, it was a bad plan. And absolutely it was a bad plan. However, you don't win on luck or just a bad plan with when the other team has has $40 million and we've got about $1.25. This was done again through education and through the effort that you do. I can't stress that enough. It was a bad plan. These people thought they were going to take the marijuana market and control it and make billions of dollars. It was a money grab. They also used, as I put in quotes, celebrities. Buddy the mascot was a huge blunder. It's something that's still being made fun of. Seth Meyers did a piece last week on his show. Stephen Colbert, another one, did a piece on Buddy in his show. I mean, it was looked at as a joke. And someone, I think Seth Meyers said, you know how we know this was created by crony monopolists? Because the weed guy had abs, and you never do. He said you never have marijuana and then say, well, let's do 1,000 crunches. So I mean, it was a joke of a campaign. Also, Nick Lachey, that they thought could bring in that celebrity factor, was basically he was minimalized because he was seen as such a joke in his campaign, that somehow the weed kingpin in Ohio was going to be 98 degrees. Nick Lachey, there were two big blunders, and those two were it. Also, we took a politically smart approach, something that had never been done in this country, which is basically, yes, we had that grassroots effort, but also we remembered and we understood that this is a political battle too, not just about public health, but about politics, and we had that political structure in place that we've been working on for a couple years as well. So there were those types of things that won us this election. As we go to next steps, what are the next steps in this? It was very interesting. We've been hearing this, that if they did win this, or if we did win this, and we did, that there was going to be a medical marijuana bill introduced. The House Republicans and the House Senate have both said they're going to introduce medical marijuana bills. Why are they doing this? We just beat them. We just beat the other side and pretty much beat them into submission. What happened? Well, basically, this is a strategy, in my opinion, that if this had been a medical marijuana bill, this would have been a much harder fight for us, and we might not have been on the winning side. Basically, I think this is a strategy to stop a 2016 ballot initiative that would be all medical, and it's something that I think we have to strategize as well. In our SPECA meeting, which will be next Tuesday at 10 o'clock at the Westerville Library, we're going to have a little bit of discussion. It's a jam-packed meeting, lots of great stuff. We are going to take about a half an hour to talk about our own strategy in this. We know that this is going to get passed in some way, shape, or form. This is what the House and the Senate caucus have been talking about. This is their strategy to try to not have a medical marijuana bill put on the ballot in 2016. So we've got a couple things where we can think about, and I'd love to have this discussion on Tuesday of next week. First off, we can go with the traditional strategy of, you know what, we don't want marijuana in any way, shape, or form in this state. We've also got another option. Do we do like New Jersey and New York? Their strategy was always, you know what, we have medical marijuana in this state, but it has to go through research hospitals. It has to go through science. It has to go through studies, and can only be received through research hospitals. There can be no smoked marijuana. You can only get it for these epilepsy, these seizure activities, or those with end-of-life illnesses, those types of things. Is this a strategy we want to look at? Do we actually want to help I guess, formulate what that bill might look like, or do we want to just come out in opposition? I know politically I have my own thoughts on it, but want to know what the thoughts are of the field and what y'all think. So we'll welcome and really look forward to the conversation that we have next week. Again, this is at the SPECA meeting, November 17th at Westerville Library from 10 to 2. Again, we'll have a great conversation and would love to know what your thoughts are on our side moving forward. I know I've gotten thoughts on both sides of the issue, so would like to come up with something that we can have kind of a consensus and a common voice on. Also, as one of the last things I want to talk about, not so much marijuana, but overall, I would also like to talk about us developing kind of an advocacy group so that I'm not out there kind of guessing what the field wants when I go testify on these bills or when I talk to legislators or, when we're all doing something. We need that common voice. I don't want to represent the field if the field is in opposition to just what I'm thinking. So we need to have more of that common thread together, and would love to introduce the idea of developing a kind of an advocacy group where we'd have just some folks getting on there, sharing ideas. It'd be a conference call, hopefully, sharing ideas about what our options are and what our thoughts are on bills that are coming down the pike in the General Assembly. It's just a little more organized, and again, I want to represent you. I want us to speak with the same voice so that we can all be on the same page and not, I don't want to misrepresent, and I don't want any of us to misrepresent the field. So I didn't know if there were any questions or anything that we had. So did we have any questions? Let's see. Okay, the first question is, can you bring, okay, it's a great question from Matt Peterson. Can you bring information on marijuana alternative medications to the SPECA meeting, such as Marinol and cannabidiol oils? Absolutely. There's some, I'll bring a one-pager about these different types of medications that are out there now that are going through phase 3 of the FDA process. I know that what Drug-Free Action Alliance wants to do, and would love to hear your thoughts on this as well, is in the next few weeks actually have a forum for legislators about what kind of marijuana, what kind of medications there are that are based from marijuana, but they're not in smoke legalization like California or Colorado has done. So I'd be more than happy to bring that. Are there any other questions or anything? Okay. Are there any? Is there any concern regarding House Bill 248? The crush-proof medication will make the heroin crisis work. I think absolutely that's something we have to look at. And this is what my concern was when I talked to Representative Sprague about House Bill 250, is just because we're limiting supplies, what you're doing is it's like a balloon. Was the example that myself and Sherry Walter from OACBA was using, was if you squeeze on one end of the balloon, you're going to have the other end of the balloon kind of puff up. What we've done is we've taken so much of the pill mills with a great bill that took the pills, prescription pills, off of the market. However, we didn't do anything about the next step, which was people who were addicted. They just didn't quit. They found other means of getting high the same type of way, which led them to heroin. So there absolutely is concern about that, and I think that's something that we really need. That's why I would love to have more of an advocacy group take on this issue. How can we work what they want to do, but then add little pieces like the assessment or referral to treatment, those types of things. So those are big concerns that we have and thank you for your question, Alice. And is medical marijuana without THC available in Ohio? There's a study that is Nationwide Children's Hospital is actually doing, they got a federal grant to do the Epidiolex study. Is that available now? I've heard yes and no. So I think we have to look at this, and I'll do a little more searching about what can be done in regards to this study. I'm actually going to try to set up a meeting with this doc down in Children's Hospital to see how this works, and get y'all more information about that. But I think there are, I don't know if there are any kind of oils or anything. I know that hemp is, a little bit, I hate to say it like that, a little bit legal. There's hemp stores. I think there's a hemp shop in Toledo. You can get hemp seed stuff, but that doesn't have anything to do with medicine. So let me check on that to see if some of these, more CBD type of products are available, and what this grant says that this doc is doing at the Nationwide Children's Hospital. I don't see any other questions, but this is a topic, and I hope I gave you something to think about as far as our next strategy and these medical marijuana bills that are going to come out of the General Assembly, where we land on these. I'd love to know your thoughts on this beforehand, but also at the next SPECA meeting. I think it's going to be a good conversation, and I hope we can kind of come up, half an hour. It's kind of it's kind of almost impossible to come up with a consensus in a half an hour, but I'd like some good conversation, and I'd also like to have some kind of where are we moving in this, and what is our next steps and strategy going to be. So seeing no more questions, just thank you so much for joining me on this webinar. Again, please email me if you have any kind of questions or concerns or thoughts on any of this. If you'd like to be part of this advocacy group, I really need that started in the next couple of months, trying to keep it again more of a call than an in-person meeting. I know everybody's problems are I know that everybody's schedules are and travel budgets might not let folks travel. So let's make it some calls and really do some good stuff so that we're representing the field well. Thank you again for all that you do. You won this election. I don't care what anybody else says. You won this thing by the work you've been doing for the last number of years. Take pride in the work you do. You're just doing amazing work, and the nation is looking at us. The nation is thanking us today because of the work we've been doing. So God bless you. If you're agnostic, bless you, probably whoever, I guess. Just do the good work you're doing, and we'll talk to you again soon. Thanks so much.